for everybody.
What about, have you thought about taking this, I would think you have, into physicians' offices too? Is this a product that eventually, like would a physician get the medication and saying, I'm going to write a prescription? And how do they even communicate to say, I'm going to write a prescription? How does one take care of a person from a physician's perspective who can't speak English?
So Meducation is not designed to replace interpreters, but even if you have interpreters, it's really difficult for them to write down all the instructions that the patient needs to have. In terms of the physician groups, we thought that community health centers would be an ideal location because they see about 90% of the population is the vulnerable non-English speaking folks. We've been recently speaking with the folks at Piedmont Health Systems, and they indicated that the folks in the county health department, community health center in Siler City sees about 90% Hispanics.
Siler City really does have a large Hispanic population.
Yeah, so how do you provide that level of service without being able to speak, having all your staff speak Spanish? So it's a challenging issue.
Well, do you anticipate that it will be taken beyond the prescription utilization and go to other areas too? I mean, I don't know how, are there interpreters available in all these different languages to be able to help people from the time they go to the doctor's office?
Actually, no, they don't. And actually, we have a separate program called ProLingua, which actually speaks to the patient during a medical encounter. And it's also able to provide written discharge instructions and show demonstrations as well. So Meducation is actually one of the components of ProLingua that we developed specifically to pharmacies. We submitted a grant application to the National Institutes of Health about 4 years ago, and the National Center for Minority Health and Health Disparities is the one that funded Meducation.
Oh, good. Is it in North Carolina? Was all this developed in North Carolina?
Absolutely, just south of RDU Airport.
Oh, good. And what type of broadcasting are you already looking at in other states outside of North Carolina? Or are you launching Meducation right here in North Carolina?
Yeah, so we just finished up in November in 2009 and gave a presentation to the North Carolina Board of Pharmacy, and they referred us to the California Board of Pharmacy, where we spoke to them on January 20th, because they have a major issue there as well. So we're in the process of reaching out to other states' boards of pharmacies and also retail chains and supermarkets who seem to be very interested as well.
Absolutely. I guess the history of how you got involved, you saw the need, how it can help, the future of it. So you're just really looking to as it's kind of evolving as you go, you use it and people say, well, what about, can you add this? Or how many languages are involved already, Dr. Lee?
Right now there's English, Spanish, Korean, Mandarin, Cantonese, Russian, and Arabic. And our eventual goal is to have over 30 different languages within the next few years. So it's a real issue. And also coming from academia, you know, I've seen so many good projects that get funded, and then, you know, after the grant funding runs out, it just sits on the shelf and never gets used. And what we're trying to do is to create practical tools that can be shared and is cost effective. So, you know, whenever you say, well, we really need to provide services to this population, the argument is, it costs too much.
Can't afford an interpreter, and if so, they only have one language, so it wouldn't be helpful because very few interpreters can speak 5 languages or something to help.
Yeah. And our objective is to take away that argument. If you take away the cost issue of it, we believe there's no reason why you shouldn't be able to provide these types of services to patients.
And in reading, because the pharmacy at which I work is a member of North Carolina Mutual Wholesale Drugs, and it's extremely reasonable. And the thought of what it would do with bringing in loyal, committed patients, because they would know in this environment I'll be able to communicate properly and learn. And are there modules that go in, or how to, well, and I guess we need to take a break and then come back, and then you're going to show an example.
Yeah, we got a very short summary of the features.
Of exactly how, okay, well, let's go ahead and take a break right now, and then we'll come back and we'll show you how it works. Okay. Stay with us.
Each year, thousands of Peace Corps volunteers help promote world peace and friendship by serving others in over 75 countries. You too can be part of the Peace Corps experience right from your home. You can help provide a water well. You can construct a classroom. You can build a health clinic, and more. By making a contribution to volunteer-created projects, you can meet pressing needs in the communities in which volunteers live and serve. 100% of your donation goes toward these projects, and it's tax deductible. Find a project that interests you and get involved. Visit peacecorps.gov/donate.
Coming home can be hard if you're a veteran of Iraq or Afghanistan. You may feel like you're all alone. But you're not alone. At IAVA.org, your fellow vets are all around you. Join our free online community, get the resources you need, and connect to other vets who know where you're coming from. IAVA.org. We've got your back.
Imagine living in a world where you feel it's better to hide from the truth than face reality, where it's easier to bite your tongue than speak your mind, where you gladly give up your freedom because acting on your own is too scary, and where avoiding conflict, no matter how unpleasant things may be, is easier than embracing change. It's scary, but it's real, and it affects millions of us every year, because this is what it can feel like to live with an alcoholic. Anger, fear, embarrassment, hopelessness. But there is a way out. We're Al-Anon family groups, and we know what it's like. To locate an Al-Anon or Alateen group in your community, call 888-4-ALANON or visit alanon.alateen.org. To help them, you have to help yourself first.
When it comes to dogs, cats, and kids, sharing just comes naturally. They share their toys, their beds, even their favorite snacks. But pets and people can share other things as well, like disease. Zoonotic diseases are illnesses that can be transmitted from animals to humans, like leptospirosis, or diseases that affect both people and pets, like Lyme disease. Fortunately, you can help reduce the risk by visiting your veterinarian. Your veterinarian can help protect against zoonotic disease and potentially harmful parasites. Most important, a wellness exam from your veterinarian twice a year can help detect, treat, or prevent health problems before they become serious. So share affection, not illness, and ask your veterinarian about zoonotic disease protection for all your loved ones. A message from the American Veterinary Medical Association and your local veterinarians.